I'm speaking to you today as we just concluded our weekly press briefing here in Dr. Stephen's Hospital. I wanted to update you on a number of things. Firstly, the Shine Your Light campaign, which happened last Saturday evening at 9 o'clock all across the country. It was supported in massive numbers by the public and set out to do a few key things. Firstly, to recognise, sadly, those people who have passed away through COVID-19 and their families. Also in terms of people who are currently sick with the disease, but also to recognise the fantastic work done by healthcare workers all across the country. And I want to thank you all again for that, but it was particularly inspirational to see how the public came out in such large numbers to shine your light. As you know, we've had a significant issue in terms of delivery of PPE for the last number of weeks. We did secure a very good order from China of over 200 million. The first 31 million euros of that has been delivered over the last week or so and dispatched all across the healthcare system. We're currently in discussions with China to have the delivery of the second batch and indeed to try aim to accelerate the third batch from later in this week. We do still face very significant issues all across the healthcare system, and particularly this week in terms of gowns, and our Chief Clinical Officer will be communicating out to ensure that we use the gowns properly and effectively until we get the further delivery later this week. Finally, just want to brief you on our testing and tracing process. As you know, we've built this up hugely over the last number of weeks, and I want to thank everybody. But now we need to put in a full end-to-end process oversight. I've recently appointed Ms. Niamh O'Byrne, who'll come and work for me on a secondment from EY for the next 6 months. Very positively, we've had support and we've strengthened our overall capacity, and during this week we will now be in a position where we don't have a backlog and we'll be returning the tests in a more timely manner. And I want to thank everybody involved in that process to date. Finally, I want to say thanks to you all again, all of our staff and all healthcare workers. I really appreciate the work you're doing. I know we're still in a very difficult phase, both in our communities and indeed in our hospitals and indeed with our GPs. But I really value the work that you're doing, and I know now that the public appreciate it too. Thank you.